Today we're diving into a topic that might make you blink a few times, the often overlooked world of eye injuries.
And we're zeroing in on one condition in particular, something called hyphema.
And don't worry, we've got all the research right here, so consider this your crash course in all things hyphema.
Exactly. We'll unpack what it is and, more importantly, why it matters for your eye health.
All right, so let's set the scene. Imagine you're at a baseball game, the crowd's going wild, your kid's up at bat, and suddenly, CRXCK, foul ball. It happens in a flash, right? Now, picture that ball sailing towards someone's face, maybe even hitting their eye.
And that, unfortunately, is a scenario where hyphema can occur.
Hyphema, so what exactly are we talking about here?
We're talking about the possibility of that impact causing blood to pool in the front of the eye.
Okay, so where exactly is this blood pooling?
It's kind of like a tiny puddle forming right behind the cornea.
The cornea, that's that clear, dome-shaped outer layer of the eye.
You got it. And much like a puddle of water can distort what we see through a window, this pooling blood, which is the hyphema, can interfere with vision.
So it's not just about seeing red, it's about potentially not seeing much at all, right?
Exactly.
That makes sense, but how do doctors determine how serious it is? The research mentioned something about a grading system.
Yeah, doctors use a grading system from eye to IV to classify hyphemas.
So what distinguishes the different grades?
Well, grade I, that's the least severe, involves a small amount of blood.
Like how much, though?
Think of it like a tiny sprinkle of red pepper flakes at the bottom of the eye.
Okay, got it. And then as the grades increase?
As the grades go up, so does the amount of blood in the eye, and so does the potential for vision problems.
Let's go back to our baseball game for a second. Say that foul ball causes a grade 3 hyphema. What are we looking at?
A grade 3 hyphema, that's a serious situation. We're talking a significant amount of blood, potentially filling up a third to a half of the front of the eye.
Wow.
Vision would be severely affected. Definitely a trip to the ER situation.
No doubt about that. So blunt force trauma, like our baseball example, that's a common cause. But the research also mentioned that some people are just more prone to this than others.
You're absolutely right. It's not always just about the impact. Think of it like this. Our blood naturally clots to prevent us from bleeding too much, right?
Right.
But some people have conditions that can interfere with this process, making them more susceptible to bleeding, even in their eyes.
So it's almost like their clotting mechanism is working overtime, even for a minor injury.
Yeah, you can say that.
So what are some of those conditions that doctors typically look out for?
Well, one of the big ones is diabetes. People with diabetes often have weaker blood vessels, especially in their eyes.
And that makes them?
This makes them more prone to bleeding from even minor trauma. And it's not just diabetes we see. Other conditions can also make someone more susceptible.
Like what? What else are we talking about here?
Well, things like sickle cell anemia, for example.
Sickle cell, how does that tie into all of this?
Well, in sickle cell anemia, the red blood cells, they can actually clump together.
Okay,
And that clumping can block blood flow, which can also increase the risk of hyphema.
got it.
And then you've got certain medications that can also increase the risk. Things like blood thinners.
Blood thinners, that makes sense. So it's like a whole bunch of different things that can contribute to this.
Absolutely.
So let's say someone, whether they have one of these conditions or they've just had some kind of eye injury, what are some of those telltale signs of a hyphema? What should they be on the lookout for?
Pain. Pain is a big one.
Okay.
It could be a sharp stabbing pain or even just a dull ache.
Yeah.
But any discomfort in the eye shouldn't be ignored, especially after any kind of impact.
Right. Like your body's trying to tell you something's wrong.
Exactly. Another really common symptom is blurred vision.
Blurred vision. Okay.
It might start as just a slight haziness,
Okay.
almost like looking through a fogged up window.
Yeah.
Or it could be more severe, again, depending on how much bleeding there is.
Right. So if we think back to our baseball game scenario and someone is experiencing those symptoms, that's their cue to get off the bleachers and head straight to the doctor.
Absolutely, yeah. Early diagnosis and treatment are really key here. We're talking about protecting your vision. You don't want to take any chances with that.
Right. Yeah, for sure not. So let's talk about treatment. What happens when someone's diagnosed with a hyphema? Is there a one-size-fits-all approach, or does it vary?
It totally depends. It depends on the grade of the hyphema and any underlying conditions the person might have.
Okay.
But for those minor cases, like a grade I hyphema, doctors often recommend a conservative approach.
Okay, so what does that even mean, conservative treatment, when we're talking about an eye injury?
Basically, it means carefully monitoring the eye and giving it a chance to heal naturally. So this usually means wearing an eye shield to protect it from further injury, getting plenty of rest.
Sure.
And then avoiding any activities that might increase blood flow to the eye.
So probably no headbanging at rock concerts while you're recovering from hyphema.
Probably not a good idea.
Yeah,
Think of it like this. You've got this little pool of blood in a very delicate part of your body,
right.
and you want to let it reabsorb naturally without any added pressure.
Yeah, makes sense. What about the more serious cases, though? Like our hypothetical grade 3 hyphema from that rogue baseball.
That's when things can get a little more intense. The more severe hyphemas often require hospitalization, especially if there's a risk of complications.
Okay, so what kind of complications? What are we talking about here?
One of the biggest concerns is a spike in pressure inside the eye. Doctors call this intraocular pressure.
Intraocular pressure. Okay, and what does that mean exactly?
Well, think of your eye like this really delicate ecosystem.
Okay.
Any sort of imbalance can cause a ripple effect.
Yeah.
When blood pools in that front chamber, it can really disrupt the normal flow of fluids,
Okay.
and that's when that pressure can build up.
And if that pressure's left unchecked, that can lead to...
That's where things get really
Yeah.
serious. High pressure inside the eye can damage the optic nerve,
the optic nerve.
which is basically like the cable that transmits all the visual information from your eye to your brain.
Right.
Yeah.
So it's not just the injury itself, it's about the potential chain reaction it can trigger.
Exactly. Precisely. And that's why early intervention is just absolutely critical.
Mm-hmm.
If the pressure is too high, doctors might need to intervene with medications or, in some cases, even surgery to prevent any lasting damage.
Wow, this really highlights how important it is to take any eye injury seriously, even if it seems kind of minor at first.
100%, yeah. It's always better to be safe than sorry when it comes to your vision.
It's pretty amazing when you think about it, how this incredibly complex system in our eyes is what gives us our sight.
It really is. People compare the eye to a camera, but it's infinitely more complex than that.
Right.
And when you think that even something like a hyphema can disrupt that complexity, it makes you realize how important it is to protect our eyes.
For sure. Speaking of protection, the research also covered ways to prevent hyphema from happening in the first place. What are some of those key takeaways that our listeners should know about?
Well, a lot of hyphemas are preventable, thankfully. And it comes down to, just taking a few simple precautions and being aware of the risks.
So give us the rundown. What are the top things people can do to protect their eyes?
Number one, this one's a no-brainer. Wear eye protection.
Okay.
And I'm talking about any activity that could pose a risk to your eyes.
So we're talking about more than just those safety goggles they make us wear in science class.
Way more, yeah. I mean, think about it. Contact sports, yard work,
Oh, yeah.
even something as simple as hammering a nail can be risky.
True.
Anytime there's even a chance of projectiles, wear those safety glasses. Trust me, your eyes will thank you.
It's like wearing a seatbelt for your eyes. Better safe than sorry.
Exactly.
Yeah.
And then, for more everyday protection, a good pair of sunglasses is key.
Okay, yeah.
Think of them like sunscreen for your eyes, shielding them from those harmful UV rays.
Sunglasses, check. What about other everyday habits? Anything we should be mindful of?
Absolutely.
Yeah.
If you already know you have one of those risk factors we talked about, like diabetes, or if you're on certain medications,
Right.
just be extra careful about protecting your eyes. Talk to your doctor, ask them what activities you might need to avoid,
Okay.
and always, always report any kind of eye discomfort or changes in your vision to your doctor.
Don't mess around with your eyes.
Exactly.
It sounds like a little knowledge can go a long way when it comes to eye health.
Knowledge is power, that's for sure.
Yeah.
The more you understand about your eyes, the better you can protect them.
Well said. As we wrap up here, what's one key takeaway you hope our listeners will walk away with today?
Don't take your vision for granted.
Mm.
It really is a precious gift, one that deserves our attention and care.
Couldn't agree more. And on that note, I want to leave our listeners with a thought to ponder. Next time you're at a basketball game, hockey game, any sporting event, really, take a moment to really think about how vulnerable, but also how resilient the human eye is. Those athletes are putting their vision on the line every time they step onto the court or the field. And in a lot of ways, so are we. Even in our everyday lives, we just don't always realize it.
It's a good reminder for all of us to be proactive about our eye health. Just a few small steps can make a world of difference.
I could not agree more. And with that, we'll wrap up this deep dive into the fascinating world of eye injuries. Until next time, stay curious.
And protect those eyes.